Hello everyone, it's Dr. Jawad. Thank you for tuning in to my channel. If you haven't done so already, just 4 things. 1, the subscribe button. 2, the like button. 3, the bell notification. And 4, leave a comment or ask a question. I will be more than happy to answer very, very simple questions when you put them down there. People have asked me in the past, where do I recommend buying my products from, my supplements? And now I have a link to a store. It's in the notes down below. Full script. You could click on that link and it'll take you to my online store. Now there's over 300 brands there. So when the question of branding comes up, this is where I can say do your research. Find the brand that suits you best because there's over 300 different brands for you to choose from online. So thank you very much for supporting my channel. I appreciate it and enjoy the video. Thank you. Hello everyone, this is Dr. Jawad. Thank you for tuning in. I had a viewer write in some time ago and ask about the mechanism of statins, why they're prescribed, and list the side effects and how that correlates to cholesterol. Because cholesterol is really not that bad. I mean, really, if you have 300 number cholesterol, what does that feel like? That's always the question that I want to ask them is, okay, so you have high cholesterol. What does that feel like? Is cholesterol really that bad? It's not. Cholesterol is not bad at all. So when I'm doing my work with patients, all I'm curious about is the triglycerides. I did a video before about the triglycerides because the triglycerides, that's the blood fat. That's your ho-hos and ding-dongs. So if your cholesterol is elevated, I look at the triglyceride levels and say, wow, it's in the 200s or 300s. What are you eating? That's a ho-hos and ding-dongs and crap and all that stuff that will cause systemic inflammation, which will cause a narrowing of the arterial system to eventually block it off and so forth and so on. So remember, it's not cholesterol that's bad. And I'll let you know, it's the triglycerides. That's bad. But, so when you go to the doctor and you do blood labs and they say, oh, your cholesterol level is above 200, you need to be on a statin drug. Well, what does that mean? Because remember, we need cholesterol for function. Cholesterol has over 300 functions of the body, so by hindering the cholesterol, you're going to hinder how the body works. So when it comes to cholesterol medications, the suffix is always statin. Now at the current time, there's about 7 popular statin drugs that are circulating through America right now. And it all depends on, they do have a side effect, and they shuffle you according to the side effect that you're having. They all have side effects. But when it comes to statins, why do they prescribe it? They prescribe it because, oh my goodness, it's used to lower the bad cholesterol in the blood. What's the bad cholesterol? Fatty deposits build up in the arterial walls and increases the risk of heart disease and circulatory diseases. So you have these pipeline, I always say. And again, let's say that you're eating bad or you're stressed out. What happens is that inside the arterial wall, it starts to scrape up on the arterial wall. So then you have a calcium plug that comes up and patches it. That's the low density lipoprotein. That's the bad cholesterol. The good cholesterol, the high density lipoproteins, they come and they thin out the arterial walls and sand it down, patch it up, and then it recirculates. 95% of cholesterol gets recirculated in the body. So when it comes to cholesterol, cholesterol is made in the liver and it's transported throughout the whole body through a lipoprotein transport system, lipoproteins. Now there's different types of lipoproteins. I'm just going to talk about the 2 main ones. The LDL, which is the bad cholesterol. Now that transports cholesterol around the body, depositing in the arterial walls. So that is the cleanup crew. Then you have the HDL, the high density lipoproteins, the good cholesterol. That transports cholesterol from the body back to the liver to be broken down and recycled. So is it really bad cholesterol, or is it really the residual effects of triglycerides? That's your blood fat. Because remember, answer me this. If you have cholesterol 300, how's that feel? How's that feel? I'm curious. Because remember, the body recycles up to 95% of cholesterol that's secreted, and it's made in the liver. So then here's a question that you could ask your primary doc or whomever. Is cholesterol really bad for us? Because I'm just going to list 7 benefits of cholesterol, because remember, cholesterol has over 300 benefits throughout the body. We need it for normal hormonal function. We need it for brain function. We need it for a lot of functions, mitochondrial function. So is it really that bad? So number 1, I'm just grab 7. It assists in the making of the cell membranes of the entire body. Now, every single cell membrane in our entire body has what's called a phospholipid bilayer. Basically, it's a double fat layer, and it's made from cholesterol. And how is it produced? By eating good fat. Avocados, olive oil, things like that. You need fat to make cholesterol appropriately, so it could help you make the cell membranes in the entire body. Number 2, it strengthens the immune system. Well, it strengthens the immune system. So you mean to tell me that by having cholesterol and eating cholesterol, I'm going to boost my immune system? Yes. 3, sex hormones. Oh my goodness, sex hormones. Testosterone, progesterones, estrogens are all made from cholesterol. The adrenal hormones. The adrenal hormones, those help you adapt to stress. It helps control cortisol. It helps control the sex hormones. It helps control blood pressure. Remember, it's the kidneys that regulate the blood pressure. The adrenal hormones, cortisol, aldosterone. Aldosterone helps regulate blood pressure. It helps deal with the sodium and the water content throughout the body. Cholesterol goes to the skin. So when it's exposed to sunlight, what that does, that turns into vitamin D, and vitamin D is a prohormone that has a plethora of benefits throughout the whole body. So is cholesterol really that bad? Your brain and your nerves. Wow, your brain and your nerves. Your body is made up of 2 things, essential proteins and essential fatty acids. The myelin sheath that surrounds the nerve, that's made from fat, good fat. Your brain is good fat. So the brain nerve is made of cholesterol. So what happens when you're taking statins, this is where you get memory issues. I know a lot of people, especially females, who are on cholesterol medications, and they just forget they don't feel like themselves. Now, before I say this, the last one, so the body recycles 95% of cholesterol that's secreted as bile. So bile is important because it's made in the liver. So bile that's made from the gallbladder. So the body uses bile to break down fats, and bile is made from what? Cholesterol. So you see this, so if you're on a statin medication, you're blocking the formation of cholesterol, which will affect bile. And if you affect the bile production, then you're not breaking down the fats and absorbing the fat nutrient vitamins, fat-soluble vitamins, A, D, E, and K. Now, if you don't have a gallbladder and you're on a statin, the body can't break down fats. So it comes down to the statin mechanism. What is the mechanism of a statin? So when you have the whole cascade of cholesterol production, statins block the liver enzyme. Remember, cholesterol is made in the liver. It blocks a very important liver enzyme, HMG CoA Reductase. And that's in charge of cholesterol production. It catalyzes the reduction of HMG CoA, which eventually turns into malvalonic acid, which eventually will turn into cholesterol. So you're blocking this cascade. Now, there's a reduction of cholesterol being produced by the liver, and it blocks all cholesterol, not just LDL, HDL, VLDL, all cholesterol is being blocked, the production of it. Now there's a reduction of cholesterol being produced by the liver, so then now less cholesterol is being produced by the liver, so the liver responds by increasing the LDL receptors, the bad cholesterol receptors, so then more LDL moves from the bloodstream to the liver. So this is where you get the reduction of the LDL, the bad cholesterol levels in the bloodstream. But what about the liver? Wait a minute, is cholesterol that bad? And what about the side effects? Okay, so here's a magic question. What are the side effects of statins? Now, with my research, there's plenty more side effects from statin drugs. Now, the thing about statin, it's like a trickle effect. You don't know when it's going to happen. I've had patients say, well, I've been on it for a while and I still don't have any side effects that I know of. And then all of a sudden, out of the blue, it's a disaster. So sometimes the statins could affect people immediately, or it may take some time. But don't forget, the common side effect that I've experienced with statins is muscle aches and pains. But that's when they've been taking it for a while. But what about all the other things that cholesterol does for the body that statins affect? Okay, so who's really at risk? Who is the high-risk people, like the characteristics? Typically, who increases the risk of side effects of statins are the female gender. The older you are, older than 80, the older population, anybody with a medical condition, kidney disease, liver disease, hypothyroidism, and also people who are smaller in stature, meaning they're thinner. They're thinner, not lean thin, but I'm just saying thinner, because typically with skinny fat, they may be thin, but they'll usually have malabsorption syndrome. Besides that, what activities are being done that will increase the risk of statin side effects? Drinking alcohol. Alcohol does damage to the liver. So do statins. So you're increasing the chance of having hepatitis or any type of liver damage by drinking alcohol and taking a statin. In addition to grapefruit. Grapefruit inhibits the metabolism of a lot of prescription medications, and statins one of them. Cholesterol medications. Sometimes people are taking 2 medications at once, 2 or 3 cholesterol medications at once. Like, 1 is not good enough, so you have to stack 2 and 3. Antibiotics. I know people go on antibiotics for short amount of time, but by being on the antibiotics, it'll increase the side effects of a statin. Antifungals. Warfarin. Warfarin is definitely will increase the side effects of statins. Heart medications. Cyclosporine. Polypharmacy. The more medications you take, it boggles down the liver. It affects the liver because the liver is a phenomenal organ that metabolizes stuff. It turns the inactive vitamins to active. So by taking a lot of medications, it hinders the effects of the liver. And then there increases the chances of getting what's called non-alcoholic fatty liver disease. And just makes the liver more boggy. So let's go over some side effects. Now, again, I always encourage the viewers, do your research. I just came up with 10. I found about 30, at least 30 of them before I said, okay, I'm just gonna do the top 10. So do your research on statin medications. And also, in addition, I'm not going on this video, but things you could take to avoid the side effects, but also, is cholesterol really that bad? Lowers the amount of vitamin K2 in the form of MK4 that's stored in the kidneys. Now, one of the things that vitamin K2 does, that breaks down that calcium buildup in the arteries. So by taking a statin, it lowers the amount. It puts the kibosh on the job of vitamin K2. And they say with statins, it's going to lower the chances of heart disease. No, with statins, it increases the chance because it lowers the amount of vitamin K2. What does vitamin K2 do? It naturally removes the plaque buildup in the arterial system. In addition, it lowers testosterone levels in both males and females. Remember, cholesterol is needed to produce our hormones. And for females postmenopausal, when your ovaries shut down, everything is being produced where? In the adrenal glands. So by taking a statin, it lowers those levels because it starts off with testosterone and then it converts to estrogen. 3, it increases the risk of type 2 diabetes. It increases your blood sugar levels. It decreases levels of CoQ10, ubiquinol levels. Now, CoQ10, it's needed for mitochondrial function. Every single cell in our body has what's called mitochondria, and one of the functions of mitochondria is to produce ATP, your energy currency. So going upstream, what statins do, it decreases the level of that being produced, and this is where you get a lot of the muscle aches. And your heart, don't forget, is a muscle. It beats 365 24/7. 5, it raises your liver enzymes, ALT, ALP, AST, GGT, which when you get blood work done, they're not really testing the cholesterol levels because if you're taking a statin, your cholesterol should be normal. They're looking at the liver enzymes because the statin medications pulverizes the liver. And if you get increased liver enzymes, it's a sign of irritation, inflammation, and you don't want that. You don't want the chances of increasing chances of having hepatitis. It decreases your energy levels. Wow, it decreases your energy levels because it decreases the levels of CoQ10, ubiquinol, which is needed for energy production for the mitochondria. So it decreases energy levels, then you'll increase exercise fatigue. I've known patients that can't walk 2 blocks without feeling fatigued because they're on a statin. Number 7, lowers DHEA levels. Remember, DHEA, females postmenopausal, is produced in the adrenal glands. And a DHEA makes testosterone. Okay, let's go a few up. So what it does, it lowers testosterone levels. You see how all this works? So now it lowers the DHEA levels, which is produced in the adrenal glands. By the way, what produces DHEA? Let's go upstream, the start of the domino. Cholesterol. Cholesterol starts that whole cascade. And if you're putting a block on that cholesterol, this whole domino effect doesn't work. Number 8, worsens memory. Maybe it increases the risk of dementia. Remember, what is the brain made out of? Fat. What's your nervous system made out of? Fat. You need cholesterol for that function. So if you're blocking the function of cholesterol, sure, I know a lot of 50-year-olds who feel like they're 90 and 80 with the brain. They forget. Okay, number 9, increases the risk of having shingles. I thought this was amazing. Now, coincidentally, they're coming out with for shingles. Wow. If you're on a statin, it increases the risk of having this. Why? Because remember, cholesterol is good for the immune system. Number 10, increase the risk of, this is for men, erectile dysfunction. Why? Because sex hormones are made from cholesterol. If you're blocking the inflow of the necessary constituents to get Mr. Happy up, yes, and again, it's not all at once. It may be in due time. So when Mr. Happy doesn't want to come out to play, it could be the effects of, there you go. Thanks for the viewer who wrote in. That was a good suggestion. I appreciate it. If you have any questions or comments, lay them down below. If you want a consultation, which I always would love to, www.totalwellnessdepage.com. Book me for a consultation. Let's talk. We can do a Zoom call, phone call, and just get you better health. I appreciate it. Hey, thank you very much for watching. Be good.